Hello, my name's Calliope.
And I'm Samil.
If you're watching this video, you'll be visiting the Royal Hobart Hospital Paediatric Ward.
We are here to help you. Today, we'll be finding out where the paediatric ward is, what's in there, and who you're likely to meet.
We'll also be finding out what sort of things you should pack for your visit and what it is like to stay there.
Paediatric is a big word. It means medicine for children.
The paediatric ward is a place where children go when they have to go to hospital.
The Royal Hobart Hospital's paediatric ward is set up to make your hospital visit as comfortable as possible.
And there are a lot of special people working there whose job it is to look after young people. Let's go and meet some.
The paediatric ward is in building K6. As you arrive in the ward, there is a reception area where there will be someone to help you.
All the patients are children and they are split up into two sides, with the east side usually for patients 0 to 12 years old and the west side usually for patients 13 to 18 years old. You'll have someone come and take you to your room, like Nathan. He's a paediatric nurse and they are really good at looking after you. So Nathan, what is a room like in the paediatric ward?
The rooms are great. So in the room you might be sharing with someone else, or you might have your own area. You will definitely have your own space which has your own bed. You'll have some cupboards to store some things. You'll even have your own TV.
What sort of special areas do you have here?
There's lots of special areas. The first being a treatment room where you go and get some procedures done. You might be taken down to medical imaging where you get some photos taken. There's even a gym, which you might see a physiotherapist, a family room to relax, and even a school room.
You have a school here?
We sure do. With the school, you can come here in the morning, have a chat with some of the teachers who are here, help you get through some of your schoolwork which you might be missing whilst you're getting help or whilst you're unwell.
An important question. What's the food like?
Oh, the food. We have lots of access to ice creams, icy poles, jelly, custard, and of course my favourite, toasted cheese sandwich. Each day you'll be given a menu where you can have breakfast, lunch and dinner. You can select certain foods from there and they're quite enjoyable.
Do you have any tips for children coming to visit the paediatric ward?
Yes, I would suggest bringing some pyjamas, a spare change of clothes, some toiletries including a toothbrush. You might need some nappies or some wipes, and definitely need to bring your favourite toy or your favourite game. Sometimes it can be a bit slow and you might have to wait around a bit.
Once you are settled into your room, there will be tests done and some equipment may be set up. Sometimes it can be a bit noisy. Then you'll need to see a doctor. It may be a doctor you've met before, or perhaps it's someone new. Let's meet one now.
This is Dr. Liz. She's a paediatrician, a special name for a doctor who cares for children. Dr. Liz, this seems like a busy place. What sort of things are children here for?
Well, we look after all kinds of paediatric patients. They might be here because they've got a nasty cold or a broken bone. Sometimes people have been in accidents or they might have an infection, and we'll look after all of them no matter what. What's really important to us is that you guys, the patients, and their mum and dad or carers all understand what's happening.
I can have a family member come and stay with me when I'm in the paediatric ward. Why is that important?
We like all of our patients to have their families and carers nearby, and encourage them all to stay with us because they're the experts in you guys, our patients, and what you guys and what our patients and their families need.
There seems to be lots of busy people here. What other people will I meet while staying here?
It can be a really busy place sometimes and it takes a little bit to get used to, but there are nurses like Nathan, there are medical doctors like me, and then there are surgical doctors, and there are other people like physiotherapists, speech pathologists, dietitians. There's also a play specialist and a diversional therapist. And then there are lots of other people too, like medical orderlies who push the bed or the wheelchair around, or ward aides, ward clerks, and there are cleaners as well.
What is a play specialist?
So a play specialist is someone who can help to prepare you for procedures that you might need while you're in hospital, and then they can also just make your hospital stay a little bit more fun while you're here.
Coming into the hospital can be scary for some people. Should I be scared when I come in?
There are lots of different procedures that you might need to have when you come into hospital. We do have some really great things to help distract you, but sometimes you might like to bring in your own things like a special toy or an iPad with your favourite show. Things can get a little bit slow in the hospital, and so you do have to wait sometimes, and then other times they can happen really quickly. But what's really important is that if you're ever unsure of what's going on, you just ask the doctors and nurses.
Can people come and visit?
Yeah, visitors are always welcome in the hospital. We do have visiting hours, and so they have to come during those times. And we do like to limit them as well, because we want to help you to rest and get better. And sometimes it's overwhelming when there's lots of people. But just ask the staff when the visiting hours are.
Any last tips for someone coming to the paediatric ward?
Just remember that we're all here to help you have the most comfortable time possible, and if you're worried or you have any questions, just come and ask any of the staff and we'll answer your questions as best we can.
Well, there you have it, the Royal Hobart Hospital Paediatric Ward.
We hope you found this video helpful. Thank you and goodbye.
Goodbye.